Question 1. A patient with a history of epilepsy experiences a tonic-clonic seizure. Which action should the nurse prioritize? A. Restrain the patient's limbs to prevent injury. B. Insert an oral airway to maintain airway patency. C. Turn the patient to the side and protect the head. D. Administer 4-diazepam immediately. Answer. C. Turn the patient to the side and protect the head. Question 2. Which patient should the nurse see first? A. A patient with epilepsy who has missed one dose of phenytoin. B. A patient with epilepsy who reports feeling an aura. C. A patient who had a seizure 30 minutes ago and is now confused. D. A patient with epilepsy who is vomiting. Answer. B. A patient with epilepsy who reports feeling an aura. Question 3. A nurse is caring for a patient on phenytoin therapy. Which lab result requires immediate intervention? A. Sodium 140 milliequivalent/L. B. Phenytoin level 25 micrograms per milliliter. C. Hemoglobin 13G/DL. D. Calcium 9.2 milligrams per deciliter. Answer. B. Phenytoin level 25 micrograms per milliliter. Question 4. During a seizure, the unlicensed assistive personnel UAP begins to insert a tongue blade into the patient's mouth. What should the nurse do first? A. Instruct the UAP to stop immediately. B. Assist the UAP with the task. C. Document the UAP's actions in the record. D. Leave to notify the provider. Answer. A. Instruct the UAP to stop immediately. Question 5. Which task can be delegated to a UAP for a stable patient with epilepsy? A. Assessing seizure history. B. Teaching seizure precautions. C. Placing suction setup at bedside. D. Evaluating medication effectiveness. Answer. C. Placing suction setup at bedside. Question 6. A nurse prepares to administer lorazepam to a seizing patient. What is the priority nursing action before administration? A. Check pupil reactivity. B. Verify for access patency. C. Record the seizure duration. D. Assess the patient's gag reflex. Answer. B. Verify for access patency. Question 7. Which finding requires immediate action in a patient taking valproic acid? A. Elevated AST and ALT. B. Decreased appetite. C. Hair thinning. D. Weight gain. Answer. A. Elevated AST and ALT. Question 8. A patient with epilepsy is being discharged. What instruction is most important for the nurse to provide? A. Avoid taking showers alone. B. Keep a seizure diary. C. Take medication at the same time daily. D. Inform family about CPR. Answer. C. Take medication at the same time daily. Question 9. A patient has been diagnosed with status epilepticus. Which medication should the nurse expect to administer first? A. Levetiracetam orally. B. Diazepam 4. C. Phenytoin orally. D. Valproate IVPB. Answer. B. Diazepam 4. Question 10. A nurse enters the room and finds a patient actively seizing. What is the nurse's initial response? A. Call the rapid response team. B. Place a pillow under the head and time the seizure. C. Check the oxygen saturation. D. Open the airway using a head tilt chin lift. Answer. B. Place a pillow under the head and time the seizure. Question 11. What action should the nurse take to ensure safety when a patient has a seizure in bed? A. Apply soft wrist restraints. B. Insert padded tongue blade. C. Lower the bed and pad side rails. D. Place a call light in reach. Answer. C. Lower the bed and pad side rails. Question 12. Which patient teaching is most important for a client newly prescribed carbamazepine? A. Use sunscreen to prevent rash. B. Avoid drinking grapefruit juice. C. Eat foods high in calcium. D. Report insomnia to the provider. Answer: B. Avoid drinking grapefruit juice. Question 13. Which symptom indicates a serious adverse effect of topiramate and needs provider notification? A. Mild dizziness. B. Tingling in fingers. C. Difficulty concentrating. D. Sudden blurred vision. Answer: D. Sudden blurred vision. Question 14. A patient reports frequent seizures despite adherence to medication. What should the nurse do first? A. Instruct the patient to double the next dose. B. Notify the provider to increase the dose. C. Ask about missed doses or triggers. D. Refer the patient to a neurologist. Answer: C. Ask about missed doses or triggers. Question 15. What is the most appropriate nursing diagnosis for a patient with epilepsy? A. Acute pain related to tonic phase. B. Risk for aspiration related to decreased level of consciousness. C. Impaired verbal communication related to medication effects. D. Risk for fluid volume deficit related to medication side effects. Answer: B. Risk for aspiration related to decreased level of consciousness. Question 16. A seizure-prone patient becomes anxious and hyperventilates. What is the nurse's best response? A. Provide oxygen via nasal cannula. B. Assist the patient into a supine position. C. Encourage slow, deep breathing. D. Call the provider immediately. Answer: C. Encourage slow, deep breathing. Question 17. Which statement made by a patient indicates a need for further teaching about seizure management? A. I will not stop my medication without consulting my doctor. B. I will keep a record of when I have seizures. C. I will place a padded object in my mouth if I feel a seizure coming. D. I will wear a medical alert bracelet. Answer: C. I will place a padded object in my mouth if I feel a seizure coming. Question 18. Which assessment finding is most concerning in a postictal patient? A. Lethargy. B. Confusion. C. Glasgow Coma Scale score of 7. D. Headache. Answer: C. Glasgow Coma Scale score of 7. Question 19. A patient with epilepsy is on strict NPO status for surgery. What should the nurse do regarding the morning antiepileptic medication? A. Hold the medication until after surgery. B. Administer the medication with a small sip of water. C. Substitute with 4 version post-operatively. D. Document as held and notify the surgeon. Answer: B. Administer the medication with a small sip of water. Question 20. A nurse is teaching a group of new graduate nurses about seizure precautions. Which statement requires correction? A. Keep suction at the bedside for all seizure patients. B. Restrain the patient if they begin to seize to prevent injury. C. Pad the bed rails to prevent trauma. D. Ensure an oral airway is available if needed post-seizure. Answer: B. Restrain the patient if they begin to seize to prevent injury. Question 21. A nurse is reviewing discharge instructions with a patient newly diagnosed with epilepsy. Which statement by the patient indicates understanding? A. I can drive once I start my medication. B. I should avoid alcohol while on seizure medication. C. I will stop taking my medication if I feel better. D. I do not need to tell anyone about my condition. Answer: B. I should avoid alcohol while on seizure medication. Question 22. A nurse is caring for a patient who has just experienced a generalized tonic-clonic seizure. What is the nurse's priority assessment? A. Pupil size. B. Bowel sounds. C. Respiratory status. D. Capillary refill. Answer: C. Respiratory status. Question 23. A patient with epilepsy reports seeing flashing lights and experiencing nausea. What is the nurse's best action? A. Prepare for an imminent seizure. B. Notify the provider immediately. C. Administer an antiemetic. D. Perform a neurological assessment. Answer: A. Prepare for an imminent seizure. Question 24. Which dietary instruction is most appropriate for a child with epilepsy on a ketogenic diet? A. Increase carbohydrate intake for energy. B. Avoid foods high in fat. C. Monitor for signs of hypoglycemia. D. Encourage high-protein snacks. Answer: C. Monitor for signs of hypoglycemia. Question 25. A nurse enters a room where a patient with epilepsy is actively seizing on the floor. Which intervention is appropriate? A. Place a tongue depressor in the patient's mouth. B. Hold the patient tightly to control movements. C. Clear the surrounding area of hard objects. D. Move the patient back to bed. Answer: C. Clear the surrounding area of hard objects. Question 26. Which outcome indicates effective management of epilepsy? A. The patient reports daily seizure activity. B. The patient states, "I stopped my meds to avoid side effects." C. The patient has remained seizure-free for 6 months. D. The patient had a seizure during medication tapering. Answer: C. The patient has remained seizure-free for 6 months. Question 27. Which finding is most concerning in a patient taking lamotrigine? A. Drowsiness. B. Skin rash. C. Mild headache. D. Decreased appetite. Answer: B. Skin rash. Question 28. A nurse is assigning patients to a UAP. Which task is appropriate for the UAP to perform for a patient with epilepsy? A. Feed the patient during a postictal state. B. Document seizure characteristics. C. Assist with hygiene after a seizure. D. Teach the patient about safety precautions. Answer: C. Assist with hygiene after a seizure. Question 29. A nurse is reviewing the home environment for a patient with epilepsy. Which recommendation is most important? A. Keep low lighting throughout the house. B. Use area rugs to cushion potential falls. C. Install grab bars in the bathroom. D. Place locks on all cabinets. Answer: C. Install grab bars in the bathroom. Question 30. What is the best indicator that seizure precautions are effective? A. The patient expresses understanding of medication. B. No injury occurs during a seizure event. C. The patient reports fewer seizures. D. The bed alarm is functional. Answer: B. No injury occurs during a seizure event. Question 31. Which intervention should be avoided when caring for a patient during a seizure? A. Suctioning the airway after the seizure ends. B. Placing the patient in a side-lying position. C. Attempting to restrain the patient's movements. D. Providing oxygen if needed. Answer: C. Attempting to restrain the patient's movements. Question 32. A nurse notes jerking of the patient's right arm and leg without loss of consciousness. What type of seizure is this? A. Absence seizure. B. Tonic-clonic seizure. C. Myoclonic seizure. D. Focal motor seizure. Answer: D. Focal motor seizure. Question 33. A patient with epilepsy is to be transferred to a long-term care facility. What is the most important information to include in the transfer report? A. Favorite foods. B. Medication schedule. C. Number of siblings. D. Vision status. Answer: B. Medication schedule. Question 34. A patient with uncontrolled seizures is found unresponsive. What is the nurse's priority action? A. Perform a sternal rub. B. Administer 4 fluids. C. Check for pulse and respirations. D. Monitor pupillary reaction. Answer: C. Check for pulse and respirations. Question 35. A nurse is caring for a patient who is postictal and confused. What is the appropriate action? A. Reorient the patient and allow rest. B. Give oral fluids immediately. C. Explain the seizure in detail. D. Leave the patient alone to rest. Answer: A. Reorient the patient and allow rest. Question 36. A newly admitted patient reports a history of epilepsy. What is the nurse's priority intervention? A. Obtain the patient's last seizure date. B. Insert an indwelling urinary catheter. C. Ask about caffeine intake. D. Schedule a physical therapy consult. Answer: A. Obtain the patient's last seizure date. Question 37. A nurse is caring for a pregnant patient with epilepsy. What is the most important consideration? A. Seizure medications should be stopped during pregnancy. B. The patient will need a C-section. C. Monitor for drug teratogenicity and maintain therapeutic levels. D. Increase the dose of seizure medications immediately. Answer: C. Monitor for drug teratogenicity and maintain therapeutic levels. Question 38. A school nurse is educating staff about handling seizures. Which action should staff be taught to perform first? A. Administer rescue medications. B. Call emergency services. C. Time the duration of the seizure. D. Check blood sugar levels. Answer: C. Time the duration of the seizure. Question 39. What instruction is most important for a nurse to give to a patient with epilepsy who wants to swim? A. Swim during daytime hours. B. Always swim with a companion. C. Wear a life jacket at all times. D. Limit swimming to 15 minutes. Answer: B. Always swim with a companion. Question 40. Which lab results should the nurse monitor to evaluate valproic acid effectiveness and safety? A. Blood glucose. B. Creatinine clearance. C. Liver function tests. D. Serum calcium. Answer: C. Liver function tests. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.